This 25-year-old woman plays on a national level, and she comes to me. I've seen these consultation more often the last month, because she wants to have contraceptives. And the reason for her to have contraceptives was because she thought that it would maybe prevent any injury. So to continue, what do I want to know as a doctor when somebody comes to me with a contraceptive question? We start again that I'm asking you all the questions about the period, about your menstrual cycle, the length, how much blood loss you have. I want to have your history. What kind of medication did you use before, or which kind of contraceptive medication? Were there hormones, or was it non-hormonal contraceptive medication? And what was the reason for using contraceptive medication? We do know that 50% of the female athletes who I've seen in the Netherlands do use contraceptive medication for a non-contraceptive reason. So it's not because they don't want to get pregnant, which is definition is to use it for, but it's used because of, for example, heavy menstrual bleeding or abdominal pain, or they think it would help them for preventing injury. And we know a little bit more about that now. Last couple of years, some research has been done. So nowadays, I would not advise to give contraceptive medication, hormonal contraceptive medication, to prevent, for example, from anterior cruciate ligament injury. And Kirsty is going to tell us a bit more about this.
Okay, so before we go directly to the injury, I think it's interesting, like Emma said, to think about how many of female soccer players, female football players are using contraception. So this is a study, a recent study that I was a part of, and it's again questionnaire based, so it comes with all of the same things around sampling bias potentially and recall, and it's self-reported and so on. So keep those things in your mind. But we asked a quite large sample size, and this is from the Women's Super League in the UK. So 75 players responded. Around 25 of them, 25%, reported current hormonal contraceptive use. And so actually, when we compare this to other sports, so we've done the similar type of survey within, say, Olympic sports, this number is actually quite a bit lower. So normally we see almost a 50-50 split, so slightly lower in this particular sample. Of course, remembering that this is a survey is a bit like taking a photograph. It's a moment in time. Maybe next week the numbers change entirely. But you can see that many more had used hormonal contraceptives previously. So what this tells us is that we need to do this type of audit quite often, because the profile changes. So at one point, maybe 43% using, and then it drops to 25%. So of course, it's interesting for us to know what is the reason that they have discontinued use. The combined hormonal contraceptives accounted for the majority, so around 62% of all of those used, and then progesterone only making up the remainder. Now that makes it perhaps look like there are only two types of hormonal contraception. There are many types. This means that some of them are combined, and they could be delivered in via a pill or some other mode of delivery. And then we have the progesterone only, which are we call long-acting reversible contraceptives, and they could be more like injections, for example. So lots of different types here, but we're just taking a simple view of combined, which contain two hormones, versus progesterone only, and by definition, just containing one hormone. What's interesting to us is that when we asked these hormonal contraceptive users to tell us a little bit about their experience, so did they feel like they were regularly experiencing some adverse symptoms? And again, this word it can be a little unclear, but the better word here is side effects, because actually, as Emma said before, that when you take a type of medication or something that's exogenous, so external from the body, that can sometimes come with a different experience, so changes in physical and or emotional well-being. And so actually 38% are still saying that they have some negative experiences, and the number is much higher in progesterone only hormonal contraceptive users. So again, from a practical perspective, we would be thinking, why are they not speaking to the club doctor or going to speak to somebody like Emma? Because actually, given that there are so many varieties, combined progesterone only, pills, injections, implants, all of these different modalities, why are they not speaking to somebody about possibly changing the one they're on so that they can have a better experience? 86% did report benefits, and again, these are perceived benefits associated with their hormonal contraceptive use. Some around pain management. I mean, again, thinking about what Emma said, we were expecting a lot of them to say the advantage is contraception, but actually they talked about pain management. So perhaps these were players who had a lot of problems with their menstrual cycle, so they swapped that profile to this profile, and so they found a relief in pain, but also a lot of them, the majority of them, saying that they liked the ability to predict and control their cycles. So for example, if they were a pill user who were using the pill for 21 days and having 7 pill-free days, they knew when they were going to experience that withdrawal bleed. So that ability to do that. And of course, we mentioned one of the last questions was around medication to delay or prevent menstruation. So here, maybe in this example of the pill users, they would just maybe skip the 7 pill-free days, go on to the next pill packet for the 21 days, and then they would bypass that withdrawal bleed. So from a survey like this, very simple to do and simple questions to ask your players, but actually you can get quite a lot of useful information from this. Apologies that something seems to have gone slightly wrong with this slide. It didn't look like that earlier, but what if you concentrate on the left-hand side of the figure for a second? This represents a recent systematic review and meta-analysis around the effects of oral contraceptives on exercise performance. Now, exercise performance is a very superficial term. Again, I'll apologize. This is a general term. It's not football specific, but we looked for studies that had some either performance test or a test that might of something that might underpin performance. So for example, there might have been some strength testing or some fitness testing and so on. And so if you have a look down that slide diagram, you'll see that actually there aren't a lot of studies in this area, and of the studies, if we look at the other very strange diagram that doesn't appear exactly as it should do, this talks about the quality. And so this goes back to a point I made earlier. We don't have a lot of information, and the information we have is not particularly high quality. And so if you look at the diagrams on the right-hand side, and particularly the solid black line, if you look at the 4 bars, look at the one on the most right-hand side with the little black bar, that represents the number of high-quality studies. And all of the other grey bars that are stacked on top of that represent moderate or low or very low quality studies. And just you can see visually here that the high quality studies are in the minority and the other quality levels are in the majority. So actually, when it comes to trying to understand the effects of oral contraceptive pills on aspects of exercise performance, we don't have a lot of studies, and the studies that we do have are often not high quality. If you do want to read this full paper to understand more about this topic, this paper is open access, but I can conclude for you, I can save you a long read. And actually, with the way that it is, we have insufficient high quality evidence to really make a conclusion. So right now, we would not tell football players or any women engaging in sport that it's either an advantage or a disadvantage to use oral contraceptives. And so actually, this one is particularly on exercise performance, but you could swap out things around nutrition and other outcomes that you're interested in. And that also includes injury. So taking it back to the idea of injuries, we have insufficient high quality evidence to really determine whether or not oral contraceptives either are a benefit or a disadvantage when it comes to injury rates. So again, it's not the same slide. It has many of the same points, but of course, I'm going to say we need more high quality research, and hopefully the people here on the call in the audience, you're going to hopefully commission some of this research, this high quality research within a football setting, so we can really understand women's football. again, we need to talk about these topics within sport. So in the club, it would be good again to have somebody designated within the club that the players can speak to. Okay, I use this type of contraception. I'm not sure if it's the best one for me, and be able to look at that. So do this type of auditing and screening, and then signpost to professionals like Emma to get advice. And again, it isn't just advice on which type to take, but we have players who want to talk about either going on to hormonal contraception for the first time, but maybe also about coming off it. So if they come off a hormonal contraceptives they've been using for maybe 5 or 10 years, what can their experience be? When will their menstrual cycles return? What can they expect? If they had some issues with their menstrual cycle 10 years ago before they went on it, can they expect those sort of issues to still be there? So a lot to think about. And really what we want to do is we want to give the players some agency to make really informed choices. You know, which is the right type for me? Should I be on it? Should I come off it? And I think it's really important that whilst maybe we think sometimes about the effect of hormonal contraceptive or the possible effect they might have on performance or injury or nutrition or recovery or any of these things, we really do need to remember that hormonal contraception is a woman's right to choose. It's something that is also important away from sport. And so actually we need to make sure that, you know, unexpected, unplanned pregnancies, you know, we have to give the athletes, the players, the right to make this choice for themselves. And then we can go to other things around if it's managing menstrual symptoms or whether or not they're using it to have a predictable experience and a predictable hormonal profile. So a lot to think about, but these are some of the things that we'll be thinking about both in practice within clubs, but also from a research perspective. So Evert, back to you.
Thank you for that last case. This brings maybe immediately on the screen a question that has been burning for a while already in the chat. And that's on injuries in the menstrual cycle. You just mentioned the word Kirsty. So this might be the perfect time to see if we can answer this question, which is a rather big one, I think.
Yeah, it's a real hot topic. Everybody is speaking about this. Yes, we're all thinking about a particular ligament, right? I'm going to answer almost twice from a research perspective. So looking at the evidence, the research evidence that's available to us. Actually, it's one of the areas where there are many studies published, laboratory studies published. So we have more studies in this area. We do still have problems with the quality of the research. We also have the biggest problem, I think, for me is that the majority of research on ACL injuries and ovarian hormones, so menstrual cycles and pill use, for example, they're not done in elite athletes. So we find the translation of these studies, so they're very laboratory based, they're not in elite athletes, and so we don't really know how to translate this into the space. So there's still no consensus from the research evidence. So that's one way to put it. Another way to put it around injuries in certain phases of the menstrual cycle is when we have players now getting ACL injuries. I think most clubs on the call, you can give a little thumbs up if you do this. Probably one of the first questions you ask is, what phase of the menstrual cycle are you in? Or do you use oral contraception? And it's a question that we're asking routinely now. And actually, we're not seeing any association between a particular phase of the menstrual cycle or whether or not they use oral contraceptives and ACL injuries, for example. So bringing that to summarize, I think within the research space, there's no consensus. We still have issues around who the research is being performed on and the quality of that. So no consensus from a research perspective. So I think that's good news. So we can go back to the players and say, you don't have to be worried right now. There's not an injury phase. And then from the anecdotal, I think maybe anecdotal is the wrong word, but from the evidence coming directly from the field, in my experience in the clubs that I am really fortunate to work with, we're not seeing, again, these injuries happening in just one phase. I think we would all agree that any type of injury is usually multifactorial. And, I think we need to be pragmatic. So my answer to this is no, not a particular menstrual cycle phase. And I would encourage you to tell your players this, because I think there is real anxiety right now, and a lot of it being driven around with social media. And it's interesting, they all think they're going to have this injury when they've got their period. And if you did look at the research evidence, that's not the lab, the phase that they're seeing in the lab. So there's a contradiction there. So sorry, slightly long answer. It's nuanced. There's a lot to consider, but my answer is no. I should have just.
Oh, good. I think you answered. No, I think you answered the next question as well. Then, which adapted training sessions to the phases of the cycle?
No, not at all. And actually, that would be really difficult to do as well, especially within a team environment. So I don't think that you don't need to. There's no research evidence to dictate this. If the evidence changes, wow, we're going to have a really hard time trying to implement that. But no, there's no need to do that right now.
Thank you. Can I also look at you, Emma, for an answer to these questions? Kirsty and myself have more of a sports scientist hat on. You have a more clinical hat on. What is your take on this?
Thank you. Yeah, thank you also, Kirsty, for this nice summary. Well, I do see a lot of female athletes with this question, especially in team sports. As Kirsty already told, there's anxiety around it. And what I always tell them is that they need an individual advice. And for that, they need to go to someone who can give that to them. So, for example, general practitioner or gynecologist, it doesn't matter to me, but you go to somebody who can give you this individual advice. Because what I do think is that if you're having, for example, a lot of pain during your period, this could influence the risk of your injury. Since pain is causing, for example, being less concentrated. So for this reason, you can come to me or come to another doctor to talk about. But still, this really needs an individual advice. So I wouldn't say to all football players, just use the contraceptive pill because this will work. This individual advice is, I think, the way I look at it.